Thank you, Larry. Greatly appreciate this session and your moderation for it. We are, I think the answer to the previous section is these vaccine certifications, digital vaccine certifications can be legal, but that doesn't answer the question of whether we should do it. There's a further question, even if legal, are they ethical to do? We know that ethics and the law can separate, and we have four outstanding individuals coming from different countries and different regions of the world to address this question. What I have asked them to do is to keep their presentations really short, 5 minutes, bullet points, so that we can have more interaction and we can address more of the questions that each of you have. I will introduce them as they come up. The first presenter is Professor Ravitsky, Vardit Ravitsky. She's a professor at the School of Public Health at the University of Montreal. She's also a part-time lecturer at Harvard Medical School. She's president of the International Association of Bioethics. She serves on numerous boards of health research, especially in the focusing on the area of genomics, the NHGRI board at NIH, as well as the Canadian Institutes of Health Research. Without further ado, Vardit.
Thank you very much, Zeke. I'd like to kick off this session on ethics by triggering you. I'm inviting you to imagine the world in 6, 12, 24 months, even 3 years. And this exercise is meant, as I said, to trigger a moral reaction. In this world that I'm inviting you to imagine, vaccine passports for international travel have become a central tool in the fight against the pandemic. Citizens of rich countries have had their 2 or even 3 doses of COVID vaccines, and not just any vaccines, those that the world has come to consider as the best vaccines, best known efficacy, and produced in trusted facilities in the most regulated countries. These people can now travel anywhere because they can show proof of vaccination, of the correct type of vaccine and the correct number of doses at the border. Meanwhile, many citizens of low-income countries still do not have access to vaccines, or their government provides them with what the world has come to see as less reliable vaccines. The infection rate in their country is still such that they're considered red or high-risk visitors, and consequently, the world is closed to them. They are simply unable to travel internationally. What is the world going to look like if the global north goes back to business as usual, with people traveling for work, research, family reasons, even vacation, while citizens of the global south are trapped and shut out of most countries? Now, you might say that many barriers already exist for citizens for low and even middle-income countries when traveling internationally, such as barriers related to personal circumstances, the cost of travel, or barriers related to national policies, such as visas. But I'd like to argue that vaccine inequity presents unique, possibly unprecedented ethical challenges because lack of access is a matter of global distribution and production. And therefore, the solution must be sought at the global level. Public health considerations are, of course, crucial, and I think requiring proof of vaccination as condition of entry makes sense. But, and this is my critical point as we set the table for this session, allowing the pandemic to exacerbate global gaps long-term is an ethically unacceptable outcome. This is yet another reason global vaccine equity should be at the top of our priority list as policymakers, as bioethicists. The obvious reason is, of course, that vaccines save lives, but the inequity in freedom of movement long-term is yet another reason that I think vaccine equity is currently one of the most important issues in the world, literally. So with the assumption that vaccine passports are going to happen, the ethical challenges raised by barriers to access and the limits they will impose on freedom of movement, I think force us to consider now nuances, such as exceptions to vaccine passports or alternatives to them. These nuances are precisely what we should work on right now as we develop the concept of passport and try to harmonize its use across jurisdictions. I want to end with a point about the sort of personal
Tony.
challenge that this raises. It's funny, I am in Canada, a lot of people contacted me when vaccines started being offered recently for kids over 12 saying, what does it mean that I vaccinate my 12-year-old, who is obviously very low risk of dying from COVID, knowing that in India, healthcare providers are still unvaccinated? I'm now speaking to you from Jerusalem, where I was recently finally post-COVID reunited with my family. The over 60-year-old population is currently receiving its third dose as this national experiment. So what is it like for people to get the third dose, knowing that in other countries, many have not had their first dose? So this is an ethical conundrum of citizens in rich countries. And I think that it's an individual level expression of an ethical issue that cannot be resolved at the individual level, similar to ethical issues related to food waste in parts of the world in light of food scarcity in others. So this invites us as private citizens to put pressure on our national governments to promote global vaccine equity in any way available to them, to reduce this global inequity and to ensure that when we imagine the world, when we get the world that we just imagined in 2 and 3 years, it does not look the way I just described. Thank you.